I'm going to be discussing my women's health proposal. My topic is impacts of COVID-19 on women. So first off, for part 1, demographics of health issues affecting women. To describe the health issue, I'm going to research how COVID-19 is spread throughout the world, how it affects women's health. To discuss how it affects women, I'm going to research the long-term effects, the severity, the lifestyle changes, the symptoms, why it affects women disproportionately. I'm going to search up how it affects women compared to men in terms of social, economic, and health outcomes, which we discuss later in the presentation. The history of the health issue and disease. I'll discuss the chronology of the COVID-19 pandemic, what specific occurrences impacted women. For etiology, I will discuss the methods and viral sources of COVID-19 virus, and I will search up the biological characteristics based on gender and who and how many women received COVID, how many males received COVID, and so on. For manifestation, I'm going to search the symptoms of COVID-19 on women's health, how COVID-19 progresses differently in females, the variables that put women at greater risk of infection, the COVID-19 case rates and how they differ by gender, internationally and geographically, disparities among illness and death between women and men, how COVID-19 directly affects women's physical health, maternal and reproductive health, how it affects women's depression and anxiety levels, how COVID-19 has affected social structures, employment, abuse, caregiving, how it has allowed challenges that women have had access to medical care, treatment, immunizations. Discussing both countries, the two countries I've chosen is United States and Japan, the effects on COVID-19 of women in US and Japan, the age, gender, ethnic composition of women in both nations, the population density, urbanization, healthcare availability, once again in both nations, how each nation's public health initiatives, government policies have helped and hurt women's health, pollution levels, living situations, educational attainment of women, employment rates, income, access to resources, views toward public health, religious beliefs, caregiving responsibilities. For part 3, the cultural similarities and differences among women. Sociocultural factors could be norms of gender roles, healthcare access, work, childcare duties, cultural, racial injustice, inequality, impact on cultural beliefs. I will research racial and economic prejudices. And for power hierarchies and bias, I will research how male-dominated power structures have made women more susceptible to the pandemic's negative effects. For part 4, ethical considerations and action. For individual efforts, I will research how women in Japan and the US are overcoming obstacles presented by COVID-19, how to work remotely, family obligations, measures taken by the United States and Japan governments, the ways women's health associations are assisting women, the global organizations, could be WHO and UN, how they're addressing the women, societal responsibility, how gender roles are expected in the United States, organizational workplace flexibility, ethical considerations, giving women vaccines, making sure both nations have equal access to healthcare as well as both genders, constraints, how aspects prevent women healthcare from being promoted during the COVID-19 pandemic. And lastly, for part 5, summary and conclusions, how COVID-19 pandemic has affected women in terms of all the specific aspects in both the United States and Japan. I will be doing definitely a lot of comparison between women and men, but mainly focusing on the different aspects of women during this pandemic and how it really has affected them in every single way possible.